Hello everyone. In this session, we are going to discuss an important topic, that is cervix cancer. So usually this question comes as a long question. In your university exam, you have to write everything about the cervix cancer in the females, starting with its predisposing factor, etiology, precursor, classification, the gross and microscopy of the types, and the clinical features, the screening. The most important screening is the pap smear and the spread. So we will discuss everything about it. And sometimes you get a short question only on gross and microscopy. So you have to write that portion only. So let's start with cervix cancer. So I will be discussing the cervix cancer under following headings. First, I will let you know the introduction. Then the most common age of presentation of cervix cancer in female. Then the predisposing factor, the risk factor or etiology, whatever you say. Then the precursor lesions, the pre-malignant lesions in cervix cancer. Then we will see the classification. In the classification, we will see two important types. We will see the gross of each of them, the microscopy of each of them. Then the clinical features, the screening. The most important screening is the pap smear, the details of the pap smear, and finally the spread. So you have to learn this overview. Don't learn the details inside the overview. That has to be understood and expressed in your own words. So I will explain you everything, all the details under these headings. So you will understand it very well and you can easily recreate the answer in your exam. But if you don't understand, if you don't learn the overview, you will forget the headings. For example, if you forget to write about the precursors, so you will lose it. You know the precursors, but if you don't write it, what is the use? So you have to learn the overview. I always insist and say the students, please learn the overview. Don't learn the detail inside each of them, that you have to understand and write in your own words. But you have to learn that you have to recreate under your answer under following headings. So in your exam, if you're getting a long question on cervix cancer, for example, you are getting the question on this. So before start writing in your copy, you should frame in your mind that you are going to write your answer under these headings. So one by one, under the headings, you have to write your answer very neatly, very cleanly, and with well-labeled diagram and flowchart. So this instruction is not only for this answer, it is the generalized instruction for university exam writing. Okay, so let's start the topic, cervix cancer. Let's start the topic, that is cervix cancer. So let's start with the introduction. Cervix cancer is the most common gynecological malignancy in the world. Please learn, it is the most common gynecological malignancy in the world. And what is the age of presentation? It's very unique. It is having bimodal peak. So the first peak is seen in the middle age from 35 to 40 years of age. And the second peak is seen in the old age, that is 55 to 60 years of age. So please learn, it's bimodal. The first peak is at 35 to 40 years and the second peak is at 55 to 60 years of age. So please learn the introduction. In the introduction, write down only one line. It is the most common gynecological malignancy in the world, number one. And in the age, please write down, mention about the bimodal peak. Now coming on the etiology. Etiology means risk factors. What are the risk factors of cervix cancer? What are the risk factors? Only two risk factors. The most important risk factor is the virus. The name of the virus is HPV, human papilloma virus. It's the virus which spread via sexual intercourse. It's the STD. Okay. And the second is the environmental factors. So first we will see the detail of HPV, then we will see the detail of the environmental factors. What is the detail of the HPV? HPV is the most common risk factor for cervix cancer, and the precursor of the cervix cancer, that is SIN. That is the most common risk factor, and it is one of the DNA virus. HPV virus is one of the DNA virus, human papilloma virus, belonging to Papova family, and it is sexually transmitted. It's an STD. So which female have high risk of having HPV infection? Any female who is having multiple sexual partners. She is at high risk of conferring this HPV infection. Any female who is having first time sexual intercourse before the age of 18 years at the young age, she is at high risk of developing HPV infection in future, and she is at high risk of developing cervix carcinoma in future. Any female who is having multiple children, multiple times she become pregnant, multiple times she conceived, that is high parity. So every time she is becoming pregnant, so this is the newborn, and the delivery is taking the vaginal delivery. So when the newborn is coming out of the reproductive tract of the mother, so this is the newborn coming out of the cervix during vaginal delivery, it is putting stress on the cervix. It is putting. So if the female become pregnant multiple times, the parity is multiple, the parity is very high. Maybe she is becoming pregnant 10 times in the reproductive age group. So every time during vaginal delivery, there is a stress over the cervix. So the cervix is at high risk of developing HPV infection. So that can be the reason. The female partner is having a male sexual partner, and the male sexual partner is in multiple relationship. Multiple sexual partners is there. So that the female is in monogamous relationship with one male.